Hello, my name is CP Lim and I'm a consultant gynaecological endoscopic surgeon and endometriosis specialist at Hatfield Hospital. Endometriosis is when tissue that is similar to the lining of the uterus happens outside of the uterus. This most commonly happens along the lining of the abdomen next to the uterus and at the ovaries. What happens as a result is that there is internal bleeding and inflammation every time a woman has a period, and that causes periods to be very painful. Any woman can potentially have endometriosis. We estimate that 1 in 10 women will be affected by endometriosis. In a group of women who have difficulties in conceiving, up to 50% of this group of women will have endometriosis. The most common problem that women report if they have endometriosis is that their periods are very heavy and painful. Sometimes the pain is so bad that it would affect the quality of life and they're not able to go out or go to work. A lot of the time the pain will start just before the period starts, and it can carry on until even after a woman stops bleeding. The other common problems that women have when they have endometriosis is they sometimes report that sex is very painful. Depending on where the endometriosis is affecting within the abdomen and the pelvis, women sometimes also report problems with their bowel and their bladder, which almost always seem to follow the pattern of their period cycles. Then there's another group of women who may not have very much problems when they have endometriosis, but then they really only come to discover that they have endometriosis when they find it difficult to conceive. There are 3 tests that are available to investigate for women who may potentially have endometriosis. The first one is to do an ultrasound. An ultrasound scan of the pelvis can pick up endometriosis if it was happening at the ovaries and causes the ovaries to have cysts. The other test that is useful for endometriosis is an MRI scan. MRI scans tend to be used by specialists in planning surgery for endometriosis so that we're not too surprised when we actually eventually do an operation for endometriosis. But perhaps the most accurate form of test for endometriosis would be to have a laparoscopy. This is a minor operation where we put a keyhole into the abdomen under anesthetic to directly look into the pelvis to see if there is any endometriosis there. And because women, if they are going to have this test, are undergoing an operation anyway, I usually get their permission to perform some treatment at the same time. There's really only 4 things that can be done for endometriosis, and what treatment usually depends almost exclusively on the woman's choice. How effective are they will really depend on how well the woman tolerates the treatment, and there's always the option of moving from one treatment to the other. So the 4 things that can be done for endometriosis are: 1, we can do nothing, because endometriosis is actually benign. So effectively a woman can take pain relief and adjust the lifestyle around the symptoms, and that might be all that is needed for women with endometriosis. If fertility is not immediately desired, then the second thing we can do with endometriosis is we can give some sort of hormones. Now this could be anything from the pill or the coil to the injection or the implant. As you can see that a lot of the time hormonal contraceptives will reduce the heaviness and the pain of periods. It will also equally reduce the inflammation of endometriosis and make things a bit more bearable. The third thing we can do with endometriosis is to do something called conservative surgery. And that means we do an operation under general anesthetic, most of the time by means of a laparoscopy, to go in and cut out the disease itself. The fourth thing we can do with endometriosis is to do a laparoscopic hysterectomy. What that means is that the uterus is cut out, so a woman has no periods afterwards. If a woman has a laparoscopy, the majority of the time she would either go home the same day or the next day. And with the majority of laparoscopy, women find that they are back to normal daily activities within 2 weeks after having had the operation. Of course, some of it will depend on how much is being done at the time of laparoscopy. What I would say is that even if it was a hysterectomy, it is still very uncommon for women to find that they are not back to usual activity by the time they're about 6 weeks on from the operation. Unfortunately, endometriosis can grow back after having had the surgery. This is why it is not unusual to hear of women having had a few laparoscopies because of endometriosis over a span of a few years. Up to 20% of women will come back for more surgery within 2 years after having had initial surgery for endometriosis. If somebody has cancer, the operation for that cancer would be to cut out everything. But if somebody has endometriosis, because endometriosis is benign, the majority of surgeons will try and remove as little as we can so that we can preserve the function of the other organs that's sitting next to the disease itself. This is why it is not unusual, therefore, for women to come back with symptoms again within the spell of a few years. As a result of this, you would find that increasingly women are now turning to endometriosis specialists for the management of their endometriosis, because the care for women with endometriosis has to be individualized, depending on their personal circumstances and priorities. So patients are welcome to contact One Hatfield Hospital directly and request an appointment with myself. Alternatively, they may wish to speak to their GP about their concerns, and if collectively they still feel that having an appointment with me will be helpful, then they can contact One Hatfield Hospital and request an appointment with me after that.